Hey, Nora.
Hi,
You've got Benny?
I have Benny here.
Benicio. Tell me
Yeah.
about your experience. You had your knee joint replaced July 2nd. Today's the
Oh,
24th?
24th, yeah.
22 days ago. I can see your scar right here. I'm looking at it. Tell me about your experience. You did therapy?
I did therapy for a whole year because I learned from my last one on my bunionectomy to make sure I do my therapy. So I
So-
wasn't going to go through that again.
So, what exactly were you doing? What kind of therapies were you using to help
I
you?
was doing yoga therapy. Every morning I did the lying down,
Gentle therapeutic yoga?
gentle therapeutic yoga.
Nice.
Nydia's gentle therapeutic yoga. You can get it on YouTube.
You can.
And I did that every day for 1 hour in the morning. Wake up at 4 in the morning to do it.
Wow, that's a commitment because you're still working full time.
I'm still working full time, but
Yay.
it was well worth doing it because you can see here I'm able to bend my knee, full range of motion. It's only been 3 weeks
Yeah,
and there really is no pain.
that's
It's
amazing. How would
minimal.
you compare the pain that you had before your surgery to what you experienced, what you're experiencing now, just sitting here, as well as what you might have experienced during your rehab?
The pain before the surgery was pretty intense. Even at night, I had trouble sleeping, and now this pain is nothing. But I think it was the commitment to doing the yoga every morning without fail, and just saying, I'm going to do this. It's going to be less pain for me once I get the surgery, so it's 100% worth it.
Wow. So now there was a special situation that happened with you in this particular rehab, your right knee. Tell me about, I see a little Band-Aid there.
Yeah, what happened with my right knee is before this surgery, my right knee was the strong one. But now doing this rehab, the strong one is the left knee. And so I'm having some challenges with this one. It's moving all over the place. And so I needed to get an injection to hold me over for the next 3 months. Hopefully my next one can be in 3 months. And of course, I'm going to be committed to the therapy, doing my biking for at least 20 minutes, doing the,
Well, it's kind of like a unloaded leg press.
unloaded leg press, and then walking for 30 minutes every day, at least 30 minutes, and fitting that into my schedule. And of course, doing the yoga. So, right now I'm doing about a total of 3 hours,
Yeah.
give or take, for the therapy that I'm doing, but it has been well worth it because I really don't have pain. There's no pain, when I push down here on the incision,
And you have a really nice looking
it
incision.
hurts a little
Wow.
bit, but it doesn't even really hurt. No, but it's very well worth it. I highly recommend doing the therapy ahead of time and sticking to the plan, also following a balanced diet, low sodium, staying away from all of those foods that are empty carbs and, just snacks that all of us love, staying away from the salt, cutting back on that sodium.
Yeah, today when you went to your appointment, you checked in with a really good blood pressure and you had lost some weight, and boy.
I lost 22 pounds from the time that she said, if you gain 1 pound, I'm not going to do the surgery. So I was committed to making sure that I eat better, move more, and, just follow that diet so I could prepare for the surgery, which I'm going to continue in preparation for the next one.
That's pretty amazing. You have been a really compliant patient. You remind me of my most compliant patient. So those of you who do not know, Nora Cantu is actually my sister. And our father, Pedro Tijerina, was likely, I believe he was my most compliant patient. When he did his therapeutic yoga, he did it. He practiced it anytime, day or night. He would do his stretches. And Nora was like second running after him. He's really he was really compliant, and Nora really went for it with this surgery. I'm really, really proud of you. I'm looking forward to the next one. It was, I gotta say, it was kind of fun torturing you. But in all seriousness, it was such an honor and a privilege to be able to work with you and to show you how I love on you
Yeah.
with this particular program. So
Well, this has really helped, and I'm blessed to have a sister that has devoted that much time, and then my brother-in-law, because I've been here a little over 3 weeks, and after 3 days, it's like, yeah, go home. But no, they put up with my BS and taking very good care of me. So a lot of it goes out to the my sister and brother-in-law that have
Well,
taken care.
here
So thank
at the in-house therapeutic yoga, kind of a therapeutic yogic approach to physical therapy rehab for your total knee joint replacement. So grateful for you, Nora. I'm looking forward to the next surgery. We're going to go for it in about 3 or 4 months. We're going to do it again.
Yep, looking forward to it.
Thank you again. Love you.
Thank you. Love you too.